In today's report, the UK has removed Thailand from its red list, meaning no more hotel quarantines when returning from Thailand. Meanwhile, daily COVID cases are rising in the eastern and southern regions in Thailand, and the Thai Red Cross has denied it has profited from the sale of the Moderna vaccine. Details on these stories coming right up. Happy Friday, welcome to the Thaiger channel, and you're watching Thailand News Today, your Monday to Friday update on news in Thailand and beyond. So be sure to subscribe to the channel and keep that notification bell on. And we have some good news for the Brits, as Thailand is being removed from the UK's red list, meaning no more hotel quarantine for arrivals from the kingdom. Earlier this week, the UK dropped its advice against non-essential travel for 32 countries, but left Thailand, among others, on the red list. Now, that list will be cut to just 7 countries from Monday, with Thailand and 46 others coming off. The UK has now missed 2 summers of tourism due to tough travel restrictions that made it difficult for people to travel overseas or for international tourists to visit. Airlines have criticized the restrictions, in particular the frequency in which they are changed. The uncertainty caused by the constant changes proved a significant deterrent for travelers. However, yesterday, the UK's Transport Ministry confirmed that from Monday, October the 11th, the red list is being slashed to just 7 countries, which are Panama, Colombia, Venezuela, Peru, Ecuador, Haiti, and the Dominican Republic. A total of 47 countries, including Thailand, are being removed. The Burmese UN envoy says he's intent on seeking international support for democracy in his country. Kyaw Mo Tun was made UN envoy by the former democratically elected Burmese government, which was ousted in a military coup in February. However, he continues to be seen as representing Myanmar, as the UN Credentials Committee has not made a decision on future representation. The UN envoy has declared that if he remains in the position, he will focus on representing the people of Myanmar and their struggle for democracy in the face of military oppression. The ambassador has vowed to continue appealing for the lives of innocent Burmese citizens, calling for an end to the military coup and the restoration of democracy in his country. He says that over 1,100 civilians have been killed by the Burmese military regime and has urged the international community to understand calls for pro-democracy forces in Myanmar, encouraging an uprising against military rule. Security around the ambassador has been tightened since the discovery of an assassination plot against him last August, which is being investigated by law enforcement officials in the U.S. The governor of the eastern province of Chantaburi has issued an order to ban all sales of alcohol after a surge in COVID-19 infections. The governor says the order is meant to limit gatherings and parties by making it illegal to drink at those events. The order will be in effect until October the 31st, with fines and possible jail time for those who violate it. The province of Chantaburi borders Rayong on the west and Cambodia on the east, and daily COVID infections have been steadily creeping up since late September, as they rose to above 200 a day and jumped yesterday to 450 infections in a single day. As a result, the governor has released the harsh order prohibiting the sale of alcohol anywhere in the province, including at restaurants, grocery stores, convenience stores, shops, and malls. The governor states that this jump in infections is alarming, and a lot of it could be traced to clusters that were linked to parties, buffets, ceremonies, and local traditions, all of which had alcohol present at the events. He believed that the consumption of alcohol brings people together and is often referred to as a social lubricant, which encourages people to mix and mingle in closer proximity and let their guards down against COVID-19 safety. He said in such social situations, regulation is difficult to control. The Thai Red Cross Society has rejected a claim on social media that it had profited from the resale of Moderna vaccines. The organization was responding to a claim on Facebook that it had purchased Moderna doses through the government pharmaceutical organization and was attempting to resell them to various organizations at an inflated price. Grisada Bunrat from the Red Cross has addressed the claim, saying the organization had merely invited relevant agencies, including provincial administrations, to join its efforts to vaccinate people free of charge. He said that in April, the Thai Red Cross decided to procure vaccines from Red Cross organizations in other countries, as well as directly from manufacturers. Zulig Pharma, which is Moderna's distributor in Thailand, agreed to sell the organization 1 million doses. The Thai Red Cross used its own budget to purchase 100,000 doses at a cost of 1,100 baht per dose. The society then invited various organizations, including Chulalongkorn Hospital, to purchase an additional 150,000 doses. It also contacted 76 provincial organizations, 38 of which agreed to purchase another 750,000 doses from the government pharmaceutical organization, with the Thai Red Cross acting as an intermediary. Grisada insists the Red Cross did not resell the doses for any more than what it paid for them, adding that the information can be checked with the GPO. Meanwhile, Zulik Pharma and the GPO have advised the society that the doses will be delivered in batches from November. And now for a quick break to hear from our sponsors.
Hi, just a quick interruption to Thailand News Today. Each day for a little while we're going to be having a quick trip with Sean Stenning from 5 Star Marine. As Thailand is opening up, Phuket is certainly opening up, and trips out to the islands are on again. And let me tell you, it's never looked better. Now, Sean Stenning, 5 Star Marine, these are the people that have been feeding a lot of people in Phuket who have been suffering during COVID-19 on the island without work, without jobs. And some 350,000 life bags have been delivered by the staff here at 5 Star Marine during that time. So yes, each day we're going to take you to some of the islands. I hope you'll come and join us. Back to you, Jett.
Thai Lion Air is expanding its fleet as Thailand plans to reopen more parts of the country to international travel. The carrier's chief executive, Aswin Yangkiratiwon, says the expanded fleet will serve international destinations with a focus on markets in Singapore, Taiwan, India, and Japan. The airline is also calling on the government to confirm a concrete reopening plan and simplify entry requirements by learning from the sandbox model. Last year, the carrier was one of 7 Thai airlines to request a soft loan of 5 billion baht from the government to continue paying employees, but the help was never received. Aswin added that if Thailand can reopen and more international flights can operate, then the airline and the tourism industry will bounce back stronger. Meanwhile, Thai Lion Air says it is optimistic about an uptick in domestic travel with 2 holidays this month, in addition to the school holidays. The airline currently operates 13 domestic routes and plans to resume the Hat Yai to Udon Thani and Utapao to Chiang Mai routes before the end of the year. It will also lay on additional flights to serve Chiang Mai, Chiang Rai, and Hat Yai this month. Krabi has received 500,000 vaccines from the Ministry of Public Health as the province begins its reopening plan. Krabi, along with Phang had joined Phuket and Koh Samui Islands as sandbox destinations that international travelers could arrive into for a 7-day soft quarantine before being allowed to travel freely throughout Thailand. As of now, the province has a vaccination rate of only 35%, with high-risk groups like those over the age of 60, women over 12 weeks pregnant, and people with key underlying health conditions, about 62.5% vaccinated. Meanwhile, Minister of Public Health Anutin Chanvirakul has set the ambitious goal of 100% vaccination of the local population before fully reopening the province to foreign tourists. Right now, only key locations like Railay Beach, Koh Phi Phi, and Koh Ngai are included in the sandbox reopening plan that launched on October the 1st. The Public Health Ministry says that while COVID-19 infections are rising in the south of the country, the numbers are expected to level off within a month. Dr. Thongchai Lertwilai Ratpong says the Delta variant accounts for about 30% of infections in the region, although the Beta variant is more prevalent in Yala, Pattani, Narathiwat, and some areas in Songkhla. Thongchai says the path of the virus in the south is a few weeks behind other parts of the country, adding that most infections are cases of community transmission. The medic says that ongoing adherence to disease prevention measures should help flatten the curve within about a month. 1,949 new infections were reported in the 4 border provinces yesterday, an increase on Wednesday's 1,922. There were also 11 COVID-related deaths, up from 6 on Wednesday. The CCSA says the provinces of Songkhla, Narathiwat, and Yala are reporting some of the highest infection rates in the country. Officials in the Yala district of Betong have closed a wet market after 14 traders tested positive. A number of businesses have also had to close on Monday, and some events have been cancelled, with the municipal area reporting 50 to 60 new daily infections. Meanwhile, the governor of Songkhla has voiced his concern about the situation in his province, with a surge in infections in various districts. The governor says officials are taking steps to curtail the spread of the infection to ensure Hat Yai's planned reopening to tourism is not affected. With Thailand's reopening plans constantly delayed, hotels and hospitality groups are doubtful that international travelers will be returning again in large numbers anytime soon. That's why many hotels plan to focus primarily on attracting domestic travelers for the remainder of the year. The regional chief executive at Accor Hospitality Group, Garth Simmons, says the success of the country's reopening is dependent upon the model set for Bangkok. Garth said that while his team is preparing for the return of international tourists to the capital, they are marketing primarily towards domestic customers for the moment. This includes staycation and daycation packages, which he believes will be popular now that the lockdown measures in Bangkok are easing up. According to the Tourism Council of Thailand, unemployment in the tourism sector has reached 71%, a total of over 3 million people. Other hotels have turned to serving as alternative quarantine sites, and some have even become hospitals, or hotels that offer medical services as well. One issue that dashes the hopes of international visitors returning in large numbers is the confusing and restrictive requirements imposed on foreign travelers. The chief executive of Acid World Corps, Walapa Traisorat, said that Thailand will continue to compete with many destinations, so it is vital that travelers are not deterred by complicated travel conditions. The complicated certificate of entry process should also be relaxed, following the lead of other countries that have made similar adjustments. But according to Walapa, the experience for those entering through the reopening program has not been smooth. Tourists are required to gather and present documents to obtain the required certificate of entry. Then they also face pricey COVID-19 tests before departure, on arrival, and during their stay. The hotel operator suggests that the public health and the tourism branches of the government work together to create a cohesive plan to attract more tourists to Thailand as soon as possible. And there we have it for the report, but do check out the video that just popped up to continue watching shows on the channel. Thailand News Today will be back on Monday. Meanwhile, you're now up to date on the Thaiger.